if somebody is anxious and sweating and their heart's going bang, 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 and it triggers them into irregular heart rhythms, is the treatment what?
Well, the first thing you need to do is to get the thyroid levels back to normal. We usually do that with medications that will block the formation of thyroid hormone. You get the patient feeling better. Once we get the levels back to normal using medication, then you can decide how you want to get rid of the problem for good. You can either do that by taking the thyroid out surgically, which we don't do very often anymore, because you can treat it with a dose of radioactive iodine as an outpatient in the office and have just as good or better a response without the risk of surgery.
So if you give somebody radiation, do you do that with an X-ray, or you do it in the office? Do you drink the radioactive material?
It's real complicated, Bob. After I calculate the dose, it comes in a little capsule, and I say, here, swallow this pill.
That's complicated.
That's real complicated. That's usually just a one-time treatment.
Oh, is that right?
Gets rid of it.
Why does that pill go to the thyroid versus going to the toe?
Well, it's wonderful that the thyroid cells are the only cells in the body that concentrate and store iodine, because they got to have iodine to make thyroid hormone. In fact, the abbreviation for thyroid hormone, T4, T3, stands for 4 and 3 molecules of iodine. So thyroid's got to have a lot of iodine to make the hormone, and you can use that fact to trick the thyroid into destroying itself without the knife. You just make it radioactive. Comes in a little gelatin capsule. You swallow it down, gets absorbed, heart pumps it around. Thyroid cells can't tell the difference between a radioactive isotope of iodine and an iodine molecule that came out of a salt shaker. Looks just like iodine to them, so they scarf it up. It's sort of like killing rats with decon. If you can get the rats to eat enough of that stuff, they're going to die.
So when you give radioactive iodine in a little capsule and say, take this, and it goes to the thyroid gland and destroys some of the thyroid gland, do you frequently then destroy too much and become hypothyroid?
Oh, well, the whole thyroid's diseased. You don't want to get rid of part of it. You want to get rid of all of it. So yeah, you intentionally give enough to get rid of it. It's like a cancer. You wouldn't go in there and take out part of it. You want to get all of it. So you get rid of all of it so it can't come back and burn you in the future. Then you just take that little pill of thyroid hormone and live a totally normal life.
It sounds so simple, but it's not simple. You've really got to be a pro.